Adrenal fatigue is a condition that can affect anyone, regardless of age or sex. It's caused by an imbalance in the hormones produced by the adrenal gland. Symptoms include fatigue, stress, anxiety, mood swings, and poor sleep. There are a number of tests that can help diagnose adrenal fatigue, but it's still difficult to determine whether a person has the condition. So we are going to go over a couple easy, do-at-home tests, to determine if your adrenals are functioning properly. If you think you might have adrenal fatigue, talk to your doctor. The adrenal glands are located on top of the kidneys, and produce a variety of hormones. The adrenal glands also produce natural steroid hormones called cortisol and aldosterone as well as other hormones. The adrenal glands and their hormones have a major impact on our body including, but not limited to hormonal balance, brain health, gastrointestinal function, bone metabolism, thyroid function, blood sugar balance, inflammation, immune system function, and so much more. When diagnosing adrenal fatigue, we need to factor in personal, psychological, environmental, and work situations into our diagnostic formulas. Treatment requires proper testing, and the use of proper nutritional support and techniques to help our bodies deal with any stress and imbalance. We will review 2 at-home tests that will help determine if your adrenals are in good shape. The first test we will go over is that of the orthostatic hypotension test. This test utilizes a blood pressure monitor. The most reliable style of blood pressure monitor is one that attaches and measures from the upper arm. The ones that read from the wrist often give higher results, because the vessels in the wrist are more superficial and narrow. This is how to do the orthostatic hypotension test. First affix the monitor to your upper arm. Then lay down for approximately 5 minutes. After about 5 minutes, take your blood pressure, while lying down. Make note of the systolic pressure. This will be the top number or first number in the reading. Next, stand up and take your blood pressure again. Note the systolic number once again. You are looking for the change between the 2 systolic numbers. If your systolic pressure remains the same, or if it decreases, there is a chance you have an adrenal imbalance, or poor epinephrine secretion. This is based on the fact that epinephrine is normally secreted, when we stand, to increase our blood pressure. It increases our blood pressure to help prevent gravity from pulling blood away from our brain. If your blood pressure number drops, it might mean that epinephrine isn't there to do its job. If the systolic measurement increases 6 to 10 mm of mercury, it means you have healthy adrenal function. If the systolic measurement does not change, this means you have fair adrenal function. If the systolic measurement drops 1 to 10 mm of mercury, this means you have poor adrenal function. If the systolic measurement drops more than 10 mm of mercury, this means you have adrenal exhaustion. The second test we will go over is the Paradoxical Pupilllary reflex test. This measures the pupils' adjustments in a dark room. Here is how to do this. Stand in front of a mirror in a dark room. Shine a flashlight, near one eye at a 45-degree angle from the side. Do not shine it directly in your eye. Try not use an intense LED light. You are looking for the time of response to the stimulus. Intensity is not important. As you shine the light near your eye, observe the pupil in the mirror. You are looking for how long your pupil remains constricted for. When in the dark, your pupil should be dilated or open to let in the maximum amount of light. When you shine the light near it, your pupil should constrict. The duration of constriction can help indicate adrenal function. You will test both sides, but wait 30 seconds in the dark before repeating with the other eye. Note that there are other causes for a positive finding on this test. This is just one of the diagnostic tests. If the pupil constricts and holds for at least 20 seconds, it signifies healthy adrenal functioning. If the pupil constricts and holds for 10 seconds, then pulses. This signifies fair adrenal functioning. If the pupil constricts and pulses then enlarges after 5 to 10 seconds. This signifies poor adrenal functioning. If the pupil constricts, pulses then enlarges almost immediately. This signifies failure of adrenals. If there is an immediate pulsation and dilation or there is no constriction, this indicates adrenal exhaustion. Adrenal fatigue can be difficult to diagnose. However, these 2 easy at-home tests can be used to determine if you have it. If you suspect that you have adrenal fatigue, I encourage you to talk to your doctor about getting additional testing. Thank you.